Why would you want to build a 211 app? That's a good question with plenty of reasons to do it. Let's talk about it for a few minutes. Communication methods are changing dramatically. Look around in restaurants, offices, mass transit, and any other place. What do you see? People glued to their mobile devices. People these days seem to be more inclined to work, research, engage, shop, and communicate through apps rather than in person. For 211 and community resource specialists, our goal has always been to get people the resources they need. Calling 211 and asking for help can be embarrassing for some, cause suspicion for others, and lead some not to engage in trying to improve their situations. Building an app is a great way to put those resources in the palm of a client's hand, and in the future will be part of a more focused solution to closed-loop solutions for the social determinants of health. Before you start, consider the capabilities of the app. An app will not decrease your call volume, but it will increase your reach and impact. It's a valuable tool for evaluating unmet needs and providing data on what people are searching for, where they are, and what community resource partners were viewed. You can expect to see app access from across the country and in fact globally. Some people are moving to or from an area, interested in what services may be available in a certain municipality, or just browsing. It will show what zip codes are being researched, as well as the category and subcategory of those searches, which translates into important data on unmet needs. There are some things to consider up front before you run down this path. First, budget, 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 as an initial troubleshooting and ongoing support. Get the buy-in from your administration, resource partners, and the community, remembering that your community may be bilingual with their own set of needs. Determine what your area of coverage is going to be. Will it just be your region or statewide? Since our state 211 centers all work on the same data backbone, VisionLink, we opted for statewide coverage with the agreement of all 8 centers to share their data into the app. Be prepared for some work with the developers to help them understand resource libraries and taxonomy. Run a request for proposals or an RFP process to solicit developers. Be as specific as you can in outlining your expectations for the deliverables and ongoing support. When it's time to choose a developer, make sure you use one who has experience in creating and developing interactive apps. There are many examples of apps that were created based on a budget that precluded good design and implementation. Involve your staff in creating the vision, and keep in mind the taxonomy will be the primary element that the app will run off of. Create the English language version first, and then entertain other language transitions once that has been built, if your budget allows it. It is not as easy as simply using Google Translate to create an additional language version. There will be a lot of beta testing by bilingual staff and users before you can release it. Speaking of beta testing, you'll need to conduct lots of it. Try to break it, look for the weaknesses and address them. It's better if you find them before the public does. Choose community resource partners and internal staff to beta test the app. Intentionally choose some people who will be technologically challenged to help beta test. Those will be the people you hear from if there are problems after release. Use icons that are easy to understand and intuitive. Document all issues that you find and share them with the developer as you go. Don't collect things and then dump a big list of problems on the developer. Anticipate that your vision in the final version may be different based on the feedback and changes you'll need to make. Once your app is through the development phase and ready to release, think of ways to expand your reach to populations that may not have access to digital devices or people to help them navigate an app. For instance, we elected to create public access kiosks that we distributed to homeless shelters, libraries, community centers, food pantries, schools, medical clinics, and other locations across our region. The kiosks are really just 9th generation iPads that are in an agency-branded security podium and placed in high-traffic areas of potential clients. The iPads are locked into kiosk mode and can only be used with the app. The total cost of a kiosk at this time is only about $400. We had many agencies come to us wanting to purchase their own units, which we helped by providing the order specs and helping to set them up. We now have over 60 deployed. Remember, increased visibility equals increased access. Increased access equals increased data, and increased data equals increased relevance for all of our systems. When it's time to roll your new app out, treat it like a big deal, because it is. Some things to consider at rollout. Have plans, marketing materials, development partners, print items, media releases in multiple formats for social media, print news, TV coverage, photos, project descriptions, funders, etc. Have press conference scripts with comments from community partners and endorsements from elected officials and agency heads. Prepare your staff to be able to answer questions and speak about the project and the potential positive impacts on the work. If they don't understand it, then how do we expect the clients to? Be prepared for media inquiries, requests for demos, and community partners asking how they can be part of the project. Have community partner and user guides prepared for deployment with the kiosks. In closing, we can all learn from each other, and there's no need to reinvent the wheel. Imitation is the purest form of flattery, and in the end, we just want to connect people with unmet needs to the resources that will make their lives better. Together, we move our systems forward. Thanks for all the work you do, and please don't hesitate to contact me at any time if I can be of assistance. Stay well.